And this month we're joined by Don Dahlheimer, who is the Manager of Spiritual Care at Elmhurst Memorial Healthcare. Don is also a fellow mental health first aid instructor, and so I've had a chance to get to know him over the last couple of years. So welcome, Don. Thank you for joining us.
It's great to be here with you.
Great. So Manager of Spiritual Care, basically the chaplain at Elmhurst Memorial Healthcare. So what does a chaplain do?
Okay. It's a good question because many people have a lot of different ideas about what a chaplain is or have no idea at all. Mm-hmm. So a lot of times people think we show up when there's bad news and and to pray. And we do those things. Mm-hmm. But the scope is so much bigger than that. In fact, most chaplains go through a year-long training to learn to be a chaplain. In a program called Clinical Pastoral Education.
Okay.
So our chaplains are unit-based at the hospital, so they do rounds and they visit as many patients as they can possibly see.
So when you say unit-based, you're talking about like they're on this particular floor
Right.
Of the hospital that focuses on this issue,
Right.
or like the surgical floor, or...
So we'll have some in a concentration in cardiology, intensive care, emergency room, med-surg kind of floors,
Okay.
Oncology. So they spend time with the patient talking about how their hospital stay is, what stresses they might be experiencing as they're waiting for tests to return. So they're really helping people process what's going on in their lives. And in those situations, many times people begin to talk about some of their own personal issues. So it has a kind of a counseling-like feel to it.
Sure.
So they're trained how to be empathic, do empathic listening, how to help people sort through issues by asking open-ended questions. And with that, exploring their spirituality as a strength, being in the hospital. Mm-hmm. And some people have a really strong spirituality. Some people have a very strong religious background, and other people have nothing. Mm-hmm. But because we're meeting them as people on that human level, we can offer that emotional support, even if they're not really open at the moment for that spiritual support.
Okay. So do you tend to like visit everybody that's on a particular unit or on a particular floor, or is it more the request of the patient?
A little bit of both.
Okay.
So we do get requests, consults from the staff, from the physicians, and it's kind of prioritizing. So those go to the top of the list in terms of priority. Then we'll look at our census sheet. That gives us some information on diagnosis. And so that begins another process of prioritizing. So having a basic working knowledge of medicine is helpful because, somebody with an ovarian cancer, for example, is going to be moved up to the top of my list.
Because that's a more serious form of cancer
right.
than maybe something else.
Right, exactly. Mm-hmm. And we're a part of discharge rounds, so people give us referrals at that point in time, or we hear something that's going on in the person's life, a new diagnosis or a change in the diagnosis, and so again that becomes part of the prioritization. So it depends on how much time there is in the day, and in terms of how much those visits are. Not how much, but how much time that those visits take. People, I was going to say something about that. Now I forgot. But it's, I've always stressed with the residents quality over quantity.
Sure.
So it's never been my goal to try to see everybody. That's great if it happens, but I would take a visit that's 20, 30 minutes long over a 5-minute visit just to let you know that I'm here. Mm-hmm. So going for those quality visits, spending time with the patient, really understanding what their experience is, how I can help them becomes a bigger priority.
Okay.
So.
And I would imagine some of that work is also then with family members as
Oh,
well.
definitely.
Particularly if someone's passed away, you're ministering to the family member at that point.
Particularly in critical care, or really anywhere in the hospital, because the more difficult the diagnosis, the more acute the situation, a lot of times it will be working with family because they're trying to deal with all of this. You know, if somebody is approaching end of life, how they're dealing with that anticipated loss.
Sure.
So a lot of work with family, and I'll add, as long as we're talking about this, with staff too.
Oh, sure.
We do a lot more work with staff, it seems these days, you know, because they're impacted by their patients. They get to know them really well. They get a strong connection, and particularly if they die or something negative or bad turns out, you know, that affects them as well. And so we try to provide some care for them. If they're going through a real rough time, we'll bring up the tea cart. It's a little cart with tea on it and some goodies, and we invite them to take just a little break.
Let's sit and chat and have some tea.
Yeah, exactly. We got real teacups so that
awesome.
they can do that, and they really appreciate that. Thinking about them, I think, is more significant than the tea or whatever. It's just, you know, that they were thought of. It was recognized that this was a difficult time, that the whole pod maybe is going through a difficult time, and somebody's thinking about them.
Sure. Yeah, sometimes I think the caregivers get overlooked, that somehow they wouldn't be impacted by the things that are going on as part of their work. Yeah. So as a chaplain, what kind of degrees or academic training do you have?
Yeah. Well, most people who come into our program are master's level or in the process of getting some kind of master's in divinity, master's in theology. For me personally, I have a master's in divinity. I also have a master's in social work, so I'm a licensed clinical social worker. And I've always been very interested in systems. So I also have a license in marriage and family therapy.
So you got lots of initials after your name.
So for many years, I worked as a counselor and as a chaplain.
Okay.
What is so cool in both of those situations is being able to bring all of that together. So I've always found that when I did the counseling work, that those people who brought their spirituality into that seemed to do much better. They had more resources that they could call upon. And on the other side of the coin, in the hospital, like I said, most people view us as somebody who's coming around to pray. So when I can utilize those other skills, whether it's in social work or being aware of family systems, how people work together or don't work together, they might be a little surprised about that, but it becomes a really good resource to try to help them in some other ways beyond just the spiritual components. So.
Sure. So we've kind of started to talk about this integration between different pieces of healthcare. So when we come back from our break, I'd like to talk about that just a little bit more. So join us when we get back.
Their support changed my life.
They were like family.
My voice is now heard.
A home for every animal.
My future is bright because they cared.
This is our home now. Thank you to the 1,200 nonprofits that serve Cass and Clay counties every day.
Welcome back to Mental Health First Aid. We've been talking with Don Dahlheimer, who's the manager of spiritual care at Elmhurst Memorial Healthcare. And Don was telling us about all the kind of different things that the chaplains do within the healthcare system, and really how there's a lot more to healthcare than just fixing somebody's body kind of a thing. So one of the things we definitely wanted to talk about was sort of this integration between different aspects of healthcare, or what did you call it, integrative medicine?
Medicine, yeah.
So give us an overview of that concept.
Sure. This is, well, let me start back really at the beginning. This has been a dream for a long time. Plaintree, the hospital about 10 years ago adopted a philosophy of care called Plaintree. It's patient-centered care in a healing environment.
Okay.
And of course, our relatively new hospital has a lot of healing environment.
It is one of the most beautiful buildings, and especially hospital facilities.
So the other piece is patient-centered care, is putting the patient in the center and trying to provide services for the patient that's going to help them heal the best.
Okay.
Some of that is regular medicine, which of course happens every day. And then being able to bring in other things that are helpful in the healing process, which people are doing anyway outside of the medical care, things like acupuncture and guided imagery or mindfulness. Anyway, we've recently opened up an integrative medicine center, which I've been asked to be a part of. So I'm really excited about that. I deal in the area of mindfulness, guided imagery, hypnosis, those things that help people focus their attention inward and provide some healing or insight on the inside. And we've been doing it in the hospital for a few years now, offering guided imagery in particular. And part of the goal for that is to be able to have people be able to utilize guided imagery, maybe have a little less medication, pain medication, maybe be able to have a little less medicine to go to sleep with. That if they can find a way to relax themselves on their own, that maybe they will need less of that. Maybe it'll help distract away from their pain, or help them really be able to focus their energy and attention on something else besides their pain, besides their anxiety, whatever it is that's causing them distress. So guided imagery, if I can say a word about that, is really a use of images and metaphors that can help people feel like they're in the midst of that experience. So let's say for me it's nature. You get me thinking about nature and walking in nature, I automatically start relaxing down. Then you help me in guided imagery. This is what we'll do. We'll have them focus in on their senses. So their eyes are closed. They're more relaxed. They begin to focus in on the different images. And so I'll invite them to pay attention to what they see, what they hear, what it feels like there. As you add on the senses to that experience, it deepens that for them.
Okay.
And they get more absorbed in that whole experience. And I really haven't met anyone yet that after going through that has not released some of their anxiety, some of their stress that they're feeling. And when they can relax more, then they need less pain medication. And they need less anxiety or sleep medication. So.
As you're kind of introducing that concept to people, do you ever have people say like, oh, well, I can't do that, that's not going to work for me, or I've tried that before and it didn't work, kind of a thing?
Some do, and then I'll invite them, well, how about just a little bit of breathing exercises? Let's try that, and then if they try that and that seems to be helpful, I'll encourage them to go the next step. Well, let's try doing a little bit of guided imagery. What's a place that you like to go to relax? And they usually are quick to talk about that.
Okay.
So
you kind of ask them to dip their toe in the
Yeah.
water and see how it goes,
Yeah.
and then see
Yeah.
if they'll take more of a
Right.
chance with that kind of a thing.
Right.
And I know in the mental health first aid classes, when you teach those, you kind of do a guided imagery at the
Right.
beginning, which
Right.
is a unique thing that you can bring to your classes to just help people kind of center
Mm-hmm.
and get in that space and be ready to hear the
learn.
information that people are that we're about to kind of talk about there.
Because I find when people come there, they're still thinking about stuff that they've been doing, the traffic it took to get there, whatever it is that is a distraction for them, and this helps them to focus. It's all about focusing and relaxing, so they can be more open to hearing and participating in what's going on. So,
It's like creating a little bit of a pause
Yes.
from one space to the next,
Right,
kind of a
right.
thing. So did you have to have some extra training in terms of being able to provide that sort of mindfulness, guided imagery work with patients?
I did some of my own training with that, but I took some official training too. It was a 100 hours hypnosis course with Michael Yapko. He really taught us how to use that strategically, particularly if it was doing a counseling session, how to do some, it would probably fall in the category of brief therapy. So people who come in with a specific issue they want to deal with, not a broad scope, but just some specific issues. Being able to use hypnosis to help them address that in a more effective way, because when using hypnosis or guided imagery, it really does access more parts of your brain than just your cognitive part, just
Okay.
like us having this conversation here. It really touches on more aspects. They've done all kinds of PET scans and have watched other areas of the brain light up, you know. So in addition to the conscious and the unconscious, you're just really helping people access more of their potential and more of their abilities too. So
I was going to ask, is there research that kind of demonstrates or speaks to the effectiveness of guided imagery, of mindfulness?
They've done that around pain management. There is a lot of research about that. In terms of the hypnosis and integrative medicine, smoking cessation.
Okay.
It's shown to be very successful in that area, along with some homework and some therapy along with that. Helps people be more successful with that. So, yeah, so I'm not sure I can quote all the research
Sure.
for you right now, but it's there. It is out there, and
what's your experience sort of anecdotally with the patients that you work with at the hospital?
I find them, they're very appreciative afterwards, even though they might be a little skeptical at the beginning. There was a woman I actually saw in the integrative medicine that she was coming for weight loss. And we did a couple hypnosis sessions, and she was so amazed at the fact that, you know, she chose to lay on the cot that we have in there. And she was amazed that she said, usually if I lay like this, my back hurts all the time. My back doesn't hurt at all. She was really able to enter into the experience and just was amazed at how relaxing and how enjoyable it was for her.
Awesome. So when we come back, we can maybe talk just a little bit more about what patients can take away with them from that. So join us as we finish up our conversation with Don.
Their support changed my life.
They were like family.
My voice is now heard.
A home for every animal.
My future is bright because they cared.
This is our home now.
Thank you to the 1,200 nonprofits that serve Cass and Clay counties every day.
Welcome back to Mental Health First Aid. We've been talking with Don Dahlheimer from Elmhurst Memorial Healthcare, and you were telling us a lot about the guided imagery as one aspect of integrative medicine. But you also mentioned maybe acupuncture and some other things. So what are some other either techniques or aspects of integrative medicine?
Let me talk about what we have at the hospital and
Okay.
then what we have in the outpatient setting. Through our Mind, Body, Spirit committee, which is a part of the Plane Tree aspect, we've been working past couple of years to introduce more integrative type medicines into or make available for patients. So for example, guided imagery would be one of those. Essential oils would be another one, so aromatherapy, so that if somebody wants to experience that in their room, they can talk to their nurse and their nurse will make that available. A big hit at the hospital is always the animal-assisted therapy. So they also come around and see the patients, and that falls under this umbrella as well. Other things in the outpatient setting we can offer a little bit more. So in the Integrated Medicine Center, there's the acupuncture.
Okay.
And she keeps pretty busy in there. So there's my guided imagery. There's massage. There is also I'm not going to say it right, but she's a nutritionist. But she's so much more than that.
Okay.
I'm not really being fair to her, and she'll be mad if she looks at this and knows that I'm not describing it well. But she looks holistically at people's relationship with food, and then tries to help them and guide them through that. So, and we're hoping to continue to add more and more integrative kinds of services as we go along there.
So that center of integrated medicine it's for outpatient.
Yeah, it's at our Center for Health.
Okay.
So people can come there and take advantage of those type of services there.
So that is that often something that the doctors will write up as an order?
Right.
And I guess this is kind of a boring but important question is, does insurance pay for those kinds of things, or how do people manage that part of it?
What I've learned about insurance so far, I guess it is not my forte, but it's, again, you're right, it's important to know. So acupuncture and smoking cessation are covered by insurance.
Interesting.
So, and Snea Dixit, who's the manager of the integrative medicine, she's working on expanding that to other services as well.
Okay.
But they try to keep the prices competitive and so that people can utilize those services.
And do most of the people that come to that outpatient center, are they coming after an inpatient stay, or might they also be coming, their primary care physician makes a recommendation or something like that?
It could be somebody who just has heard about our services and wants to come in and experience that, like the acupuncture. It could be a doctor's order, could be after inpatient. It's really open to a variety of different sources of. Another example is at our cancer center. Our development office foundation did a fundraiser, and they all have 2 complimentary visits in our integrative medicine if they choose to utilize that.
Okay.
So they can come for hypnosis, guided imagery. They can come for acupuncture. They can come talk to our nutritionist, get a massage.
Nice.
So yeah, I'm really happy that we were able to offer that for them, because going through the chemo and radiation treatments can be pretty rough, and this would be a way for them to really care for themselves and maybe get some relief from some kind of pain they might be experiencing, or the anxiety of going through those treatments or whatever. So
Sure. So it sounds like And this is part of that plane tree philosophy, right? That the different aspects of the system are encouraged to talk about that
Right.
and make patients aware that those services are available. On the other side of that too is to for patients to know they could ask for those things,
Right.
or they could ask their primary care doc, or if they're inpatient, to ask about what kind of services, supportive services would be available after an inpatient stay.
Right, because again, that plane tree philosophy is patient-centered. What's going to be most helpful for the patient? What's going to help them heal the best? And that's going to be different for everybody, you know? And we want to be able to offer as much as possible to expose them to those kinds of services. So for example, coming back into the hospital, if they have some guided imagery or they have some essential oils, that they'll be able to use that then when they go home. They can continue to use those relaxation techniques around breathing or guided imagery. If they found that the aromatherapy, they could explore that more, and maybe they would find other essential oils that are helpful for them in their health or just being able to relax. So
there's definitely kind of a teaching component that goes with many of these to say, hey, here's something you can take with you, practice these things or incorporate some of these skills or techniques
Right.
At home and on your own. It doesn't have to be just the professional that's giving that
that's
to
doing
you.
that. It's just like with the nurse giving discharge instructions, you know, on how to take care of themselves or how to take certain medications. You know, they can take this along with them when they go home as well and use that as a broader tool in their healing. So really addressing that, again, that mind, body, and spirit, putting that together, that really brings the most healing into people's lives than just trying to take care of the physiological or take care of the emotional. Bring it as much as you can. Bring that together. The more potential healing is going to be available to the patient. So.
And it's empowering for
Yeah.
someone to say, oh, there's something that I can do to help myself feel better, be healthier, whatever that is, instead of just being this passive participant of, you have to make me better. I'm a part of that.
People feel so helpless when they come into the hospital. You know, they have to be in a gown. They're away from home. You know, and so they exactly right what you're saying. It helps them to be empowered. You know, and know that they have choices and they can participate in their healing. So.
Excellent. Well, thank you so much for being with us
My
today
pleasure.
to talk about some of these newer aspects of healthcare, help people to know how to advocate in terms of asking for those things. So thank you very much, Don, for joining us.
Thanks for asking me.
Thank you for being with us on Mental Health First Aid. Until next time, be well.